My name is Alicia McDonough, and the disorder I'll be speaking about today is anxiety. The Anxiety and Depression Association of America defines anxiety as a persistent, excessive, and unrealistic worry about everyday things. It's normal to experience turning in your stomach while taking a test, or worrying if you have enough money to pay your bills at the end of the month. That level of anxiety is healthy and necessary for human survival. It helps you to respond appropriately to dangerous situations. For some, anxiety can be a motivator, while for others, it can occur at inappropriate times, occur frequently, or is so intense and long-lasting that it interferes with daily activities. When that level and intensity of anxiety is reached, that is when it is considered a disorder. Anxiety is one of the most common mental disorders. It affects 12 million Americans each year and 2 times as many women than men. While the overall cause of anxiety hasn't been discovered, research shows genetic factors may increase your risk, and past experiences can also play a role in developing anxiety later in life. Anxiety affects many parts of the human body, but most of the abnormal functioning takes place in the temporal lobe of the brain. The temporal lobe houses an almond-shaped structure called the amygdala in the hypothalamus. The hypothalamus is responsible for transmitting emotions and sensations that involve anxiety. The amygdala receives signals from the parts of the brain that sense danger, which travel through the dendrites and into the nerve cell. The nerve cells process these signals and send them through the axon to areas in the nervous system that perceive fear and prompt the stress response. A hormone called corticotrophin-releasing factor, or CRF, is secreted, which triggers other hormones such as adrenaline. Anxiety prompts the fight or flight response. The body is designed to increase a person's heart rate and respirations in order for your brain to receive more oxygen in a stressful situation. The body should eventually return to homeostasis. If your body isn't receiving that message, it doesn't know to return to normal functioning, which can become problematic to other bodily systems. It can affect the cardiovascular system due to the consistent and ongoing increase in heart rate, and can contribute to inflammation in the circulatory system, particularly the coronary arteries. The gastrointestinal system is also at a higher risk for stomach ulcers, and digestion can also be impacted. Lastly, when the body is stressed, it is natural for the musculoskeletal system to tense up. This is the body's way to guard against injury and pain. That constant tension for extended periods of time can cause tension headaches and migraines. Symptoms of anxiety can start in an individual's childhood and go away as you mature. For others, the symptoms can get worse and harder to manage. The symptoms of anxiety can be physical, such as increased heart rate, perspiration, dizziness, and nausea. They can also impact your thoughts, emotions, and behaviors, such as feeling on edge or restless, irritability, difficulty concentrating, and excessive worrying about everyday decisions. Anxiety disorders are one of the most treatable mental health problems. Treatment options may include psychotherapy or medication. It depends on the type of anxiety disorder the patient is experiencing. Cognitive behavioral therapy is the most common form of psychotherapy treatment for anxiety. It teaches a person different ways of thinking, behaving, and reacting to anxiety-producing and fearful situations. It can be performed one-on-one with a trained professional or in a group setting. Medications can also be used as a treatment option. The most common types are antidepressants, anti-anxiety drugs, and beta blockers. While no medication can actually cure anxiety, they can help with the side effects. It is also found to be most effective to use medication in combination with psychotherapy. Another option to help cope with anti-anxiety is stress management techniques, such as meditation or deep breathing exercises. For those who don't seek help, it can lead to consequences both in the short and long term. Having anxiety can be isolating. Those who suffer tend to separate themselves to avoid situations that make them feel anxious. This avoidance can lead to conflicting with job requirements, family obligations, or other basic activities of daily living. People with untreated anxiety tend to suffer from other mental health disorders such as depression. This can increase their chances to abuse drugs and alcohol. Anxiety can also lead to long-term complications. The continual state of stress increases your risk for diabetes, hypertension, IBS, and heart disease. If heart disease is already something you struggle with, anxiety can raise the risk of coronary events. We all experience some forms of anxiety throughout our lifetime, and it is good to have in appropriate doses, but it is also important to know what too much can do to negatively impact our bodies.